Enlarged prostate and the side effects that accompany it is a topic that many people, they're just not comfortable talking about it. Well, joining me to discuss more, we feel comfortable with you. This is Dr. Francisco Helpe with Houston Metro Urology. I am so glad that you are back joining us because I love how you put things into perspective. And this topic, especially men, they don't want to talk about it. And there's a lot going on. And tell me a little bit about all of the different things.
Yes, so thanks again for the opportunity. Yeah, today we're going to talk a little about BPH, which stands for benign prostatic hyperplasia. It's a very common condition that men typically after the age of 40 or 50 will experience. And it basically translates to having a hard time emptying their bladder. I know that the word prostate is included there, but I really emphasize that it's most about bladder preservation and bladder health. So the idea is as we get older, your prostate will obstruct the flow of urine, and that can indirectly end up affecting the function of your bladder. Typically men will complain of a weaker stream, some urgency, frequency, and these are things that we typically start ignoring until it progresses and quality of life starts taking a hit. And that's usually when we see patients.
So you actually have a way, it's not very invasive, right, to treat this?
There's tons of ways that we can treat it. The standard of care for a really long time has been starting patients on medications. You can also work a little bit on dietary changes, behavioral changes, but as the condition progresses, normally the urinary flow is taking a hit because the urethra starts getting narrow. So there used to be ways where we have to do very aggressive or invasive procedures, and we've sort of moved away from those. Interestingly, as we've been improving the options that we have, we've come across techniques that help us not only preserve urinary function, but also preserve sexual function. And that's one of the things that we wanted to talk about, the ability of doing an office-based procedure called Rezum, where we can inject vapor into the prostate, and this causes some thermal injury that leads to the destruction of tissue. These guys, they recover super quickly. They're back to their activities basically just a day or two afterwards. And it's a very effective way of dealing with the potential side effects of medications and avoiding all of that, while again preserving the function of their bladder, which is the one thing that we worry about the most.
Geez, and not having a lot of downtime too. That's great. Super
quick and easy. Normally it takes in the order of 5-10 minutes. I actually do it just with nitrous oxide, so patients don't even have to go under.
Wow.
They go home the same day. We typically keep a catheter for a couple of days. Once a catheter comes out, all downhill from there.
Oh my goodness. So where can we go for more information or to visit you to see if we're a good candidate?
So our website is hmutx.com. Our phone number is 713-634-4441. And maybe not everyone is the right candidate, but again, it all starts with a conversation. You have to just be open about the symptoms that you're experiencing, and then see if you're the right candidate to get this or any of these maneuvers taken care of.
Or go from there. Well, as always, Doctor, I love having you on the show. Thank you so much for your time.
Thank you.